Hello and good evening. Oh, I forgot to let me take this out because this is from Twitch. Good evening, everybody. Hello. Hello, Pokari. Ventix. Hello, and Recycled Cabbage. Hello. Welcome. So, today is actually the stream tonight is actually kind of a sudden stream because this is not actually on my stream schedule. If you saw my stream schedule, which I posted on Twitter and on Facebook, this is something I started to plan just like yesterday or the day before that, because we gotta help a patient. Okay. Hello, Tree Bobber and Arch Victim. Hello. Gonna watch this while studying my anatomy class. Hello, Shroom. Okay, so the purpose of this stream, aside from being a medical education stream, is actually we're gonna I have, if you noticed up here, there's a bar up here, which I opened on my gank. So we're gonna help another patient. Another patient needs help, basically. Okay? And the topic for today is about liver tumors. Okay, I'm just gonna go through it briefly. Because liver is a very, it's a complex organ. It's an organ in the body that is has a lot of roles. A very important organ in the body. And a person cannot live without a liver. Okay? Now, so I'm going to so this stream is actually for this patient. So I'm gonna introduce to you guys, I'm gonna talk about liver tumor for a bit, and then I'll talk about the case of the patient who needs help. So I won't be able to hold like a donathon like what I used to do for my previous patients who really needed help, because I don't have time to really do a donathon. Plus I still have the, may utang pa ako sa inyo. I still have some goals that I've done before that I haven't really, that we've met before that I haven't really fulfilled yet. So I don't want to do a donathon yet. So I'm just gonna leave the donos open. So you can just donate. You just donate. There you go. And 100% of all the donations, if you see this bar up here, the goal is 500. 100% will be towards patients, okay? Let's see, who else is here? Hello, a Dr. VTuber. Yes, I am a surgeon. As a VTuber, I am a rogue surgeon. But I am also a surgeon in real life. Kiro, hello, Doc, good evening. Hello, the gallbladder just poking out like a little cutie. Yeah, I actually have a stream about the gallbladder. Di pa naman kami naniningin. Alright, so anyway, let's go to the slides. Hold on. Let's go to the, where is it? Here we go. Oh! You know what? I should be wearing my glasses! We should wear my glasses. I should be in nerd mode right now. I should be... Wait, how do I wear my glasses? Why am I not wearing my glasses? Wait, I gotta wear my glasses? Why am I not... I can't wear my glasses, but why? There we go! There we go. Gotta turn on my nerd mode. Alright. Okay! Look at how green these slides are. This is the color of bile. Well, no, bile is a little golden. Actual bile is like golden yellow, golden brown or something like that. This was just like light green, straining to the eyes, but I chose this color just to, so that you guys would strain. Alright, so we're gonna talk about livers. Sinuka color. Vomit green. Okay. Okay, hold on. So let me just okay. So our topic for the day, for the night is liver tumors. So I'll just briefly go through like the anatomy and the functions and all that. We'll just go briefly through that. Okay. Alright, let's go this way. Okay. Anatomy. Okay. So, okay, chat, do you guys know where your liver is? Do you know where in your body the liver is? Do you guys know? We gotta make this interactive, okay? You guys know where the liver is? Where your liver is in your body. Let's see. Upper left portion of my torso, tummy. The liver is on the left side. What else? Somewhere above the kidney. Okay. What else? Alright, you guys know that, oh. No idea. Okay, some of you guys don't know. Okay, some of you guys actually don't know where the liver is. Okay. Alright, so for those who answered, like, upper portion of torso or tummy, you guys are, kinda right. But the rest are kinda wrong. Right upper quadrant, right below the diaphragm. Okay, so a lot of you guys are both right and wrong. Okay. Now let's I just grabbed this image from Google. You know, a lot of my images on my PowerPoint are just like grabbed from Google. I grabbed them from Google. So your liver is in the abdomen, okay? It's not right or left. It's on both. This is your liver, okay? It's that far up. Well, it depends because your liver is under your diaphragm, which is a muscle that separates your chest from the abdomen. So while you breathe, when your lungs expand, your diaphragm pushes downwards, so your liver can actually go down over here, you know. But then when you breathe, when you exhale, it goes up. So it's just there. Your liver's just there in your abdomen, okay? The reason why some people say it's on the right, okay? It's not the left, it's the right. So this is the right side of the body. It's because the largest lobe of the liver is here. You know, the liver is divided into right and left. So the left is smaller and then the right is over here. Okay? So, here we go. Lettuce! It's a very complex organ, you know. If you look at the liver from outside, here we go. We got the right lobe and then the left lobe. And then you have the gallbladder resting right in front of, right underneath it. Like over here. It just rests down here. You got some bile ducts. So there are this over here. If you look inside the liver, it's like there is a whole circuit in the liver. So you have bile ducts, which is the green ones. So you have like the right hepatic duct and the left hepatic duct, and then it branches out. It joins down here into the common hepatic duct, and then joins the cystic duct, which is the duct connecting to the gallbladder, to form the common bile duct. And this goes down into the small intestine and to the pancreas. And then over here, you have the red is the aorta, which is the largest arterial vessel in the body. And you have the inferior vena cava, or the vena cava, which is the largest vein. Right? Okay, let me look at some questions here. Bakit ang dikit ng gallbladder sa liver is so hard to remove without popping? Okay, yeah, the gallbladder is attached to the liver. It has like a liver fossa, but it's not that hard to remove. You just gotta find the right plane, and it's pretty easy to take the gallbladder out. The only time it gets a little difficult to remove is when it's all inflamed. But that really depends. It's not that hard. Okay. So this is the anatomy of the liver. Simply speaking. But it's a lot. If we go in depth, it's very complicated. Like, for example, here, the liver is divided into segments because it's a large organ, and you have to know each part. As a surgeon, you gotta know the different locations or the different parts of the liver, and they divided the liver into segments. So there's like segment 1, which is a little underneath, right over here, and then there's 2, 3, and then they have like 4A, 4B, 5, 6, 7, 8. Okay, so this diagram is actually very important to surgeons, especially hepatobiliary surgeons, or those who specialize in the liver and the hepatobiliary. Okay, I'm gonna take a sip of my water. Okay. Alright, next. So, functions! Okay, do you guys know what the functions of the liver? Do you guys know what the liver does? Do you guys have a, like, what do you guys think? What do you think the liver does? Okay, let's see. Detox. What else? Detox. Detoxification. Detox. Okay, we got almost everybody here says detox. Cleans the blood. Okay. Okay, most of you said detox. Alright. Actually, there's more. It's more than just detox. The liver has different functions. Like, what is bile production? Okay, it has a lot of functions, but I'll focus on like the major functions. So one of them is bile production. Okay, bile. So bile is a fluid produced by your liver, or the hepatocytes of the liver, which is a hepatocyte is a liver cell. Okay. So what happens is it produces bile from the hepatocytes, and then the bile goes into what we call the bile canaliculi, which are like little pathways for the bile to go through until it enters the bile ducts, like the right and left hepatic duct, into the common hepatic duct, and then it goes into the liver for storage and concentration, or it can go straight into the duodenum, okay, or the intestine. And bile helps in digestion and absorption of fats or lipids. Okay, so you need bile to digest fat properly. Okay? Oh, shroom digestion stuff, yeah. Gallbladder was just for storage. Yeah, it's for storage and concentration of bile. So that's why people can live without it. You will just lose your storage for and you'll just lose your organ to store and concentrate the bile. But that's very much it. Hello, Jonathan. Hello. Alright. Another function is fat-soluble vitamin storage and metabolism. So your vitamins, especially the ones that are fat-soluble, like vitamin A and D. Okay, your vitamins. And this is what everybody said, detoxification. So yeah, drug metabolism or medicines. So there's some meds that are metabolized in the liver. Some are excreted through the kidneys, okay? So that's why you know how some meds, if you overdose, they give you liver damage. So that's actually why if you overdose on some certain medications, you damage your liver. That's what most people say, right? Because it's the liver that works to metabolize those. And so if you overdose, you overwork your liver, and there you go. Okay. And here, I found this photo on Google, and it pretty much gives more of an idea of what else the liver does. Okay, so again, we have the detoxification, which you guys are familiar with. Alright, we have metabolism. There's also this one. These are thyroid hormones. Okay, detoxification of fat. We have some immune system function here. We have, like, here, storage of micronutrients, like I said, vitamins. There's also, it also participates in the storage of glycogen. I forgot about this one. If you guys know your biochemistry, which I hate, it's a subject I absolutely hate. When I was in college and in med school, I absolutely hated biochemistry. Freaking glycogenolysis, Krebs cycle, and all that shiz. I hate it. If you're a med student or a biology student and you hate biochemistry, I am with you. I love biochem. I hate biochem. That was a bane of my existence. I hated biochem. I hate biochem in med school. I hated biochem in college. Freaking biochem. Okay, and then we got production of bile. And see, we have some of these. Protein synthesis, and all of that. So it's like one large organ in your body, and it does all these things. It's a complex organ, okay? It's a really complex organ, that even I myself haven't really mastered, because this is a highly specialized organ, because there's even, like, subspecialties for this specific, system. So, and I am not under that. So I can only give you a general overview, because I am not a hepatobiliary surgeon. I can only give you a general overview of this. Okay. Molecular bio. I don't think I took molecular bio. Okay, common symptoms of a liver disease. There are many symptoms, okay? Sometimes they cross over with other symptoms of other diseases. But the most common would be like abdominal pain. Most common would be abdominal pain and jaundice or icteria. Icteria is when the sclera of your eyes become yellow. The sclera is the white of your eyes. So unfortunately, Homer Simpson has white eyes, so he's not icteric. But jaundice is the yellowing of your skin. Okay. Those are the most common, but there are other, depending on what kind of liver disease you have, there are other symptoms like you can have edema or swelling of both your legs, or even ascites, which is accumulation of fluid inside your abdomen. There's also like there's vomiting, nausea. What else? There's also weight loss. It depends. It really depends. There's so many, it just crosses over with other diseases. Okay? And then, okay, next. Diagnostics. So, also, since liver is a complex organ, there are also many diagnostics we request for when assessing the liver. There are blood tests like bilirubins, which check the bilirubin levels in your body, the liver function tests, and all that. You can even ask the basic blood tests, but I'm gonna focus on the more important ones, which are the imagings. So the most basic one would be an ultrasound. It's usually the very first imaging requested, ultrasound. When an ultrasound is requested, like we have abdominal pain, and it looks like, it doesn't look like appendicitis, it looks like something else. It looks like it's coming from the top of your abdomen. Usually they would request for an ultrasound. Because the first thing people would think of is, first thing your doctors would think of is gallstones. Because that's the most common surgical, one of the most common surgeries done now. Almost everybody and their mother has gallstones. So, sometimes when they do an ultrasound, they might see something in your liver. So, yeah. And then, when they see something in your liver, if they see a mass or a tumor, something wrong there, then that's when they request a CT scan. And usually the type of CT scan is a special one. You need a special dye or contrast to see. You can't just have a normal plain CT scan. Because since the liver is a very vascular organ, very complex, you have to have, they usually order a triphasic CT scan, or sometimes they do an MRI. I think, most cases, I think the ideal would be an MRI, but not all hospitals here have an MRI, so they settle with a CT scan. Okay? Alright, I'm going to drink again. Hydrate. Alright. Next. So, alright. Liver tumors. Okay, we're going straight to liver tumors. There are different types of liver tumors, okay? I have divided them into benign and malignant. So, the focus of this, because the liver is a very complex organ, there are many diseases related to the liver, but I'm gonna focus on liver tumors because that is more that is more related to surgery. Because any other disease of the liver is managed medically, and usually those are not, we don't handle those as surgeons. We don't really handle those much, but we handle livers that have tumors. So yeah, okay. So benign tumors, we got number 1, the simple cyst. Okay, liver cyst. So this is usually congenital, you're born with it. And it's usually small, like less than 3 centimeters. They're stable in size. Usually they're also asymptomatic, or you don't really feel anything unless they get really, really big. So here's like a representative illustration of a liver cyst. So it's just like a little bubble on your liver. Okay, it can happen any part of the liver, like a little bubble right here. And this is a CT scan image I grabbed from Google. So it just looks like this. This is the liver. Okay, this is the stomach. And then this is a cyst. Okay? If you have a cyst and it's and you don't really feel anything, like you're asymptomatic, usually your doctors won't do anything. They won't touch it, they'll just leave it alone. But if you're symptomatic, and when you have symptoms of this, liver cysts with symptoms, they usually present with like they present with difficulty breathing or heaviness, because the reason why they would have symptoms is because it's really, really large. Okay, it grows really big that it you have a hard time breathing. Or it feels so heavy. And because it's so big and it's so heavy, you also have abdominal pain. So that's the time we do something. So one of the treatments is aspiration, or you just remove the fluid, suck the fluid out, aspirate it out, and then you place a sclerosing agent or like alcohol or something just to make sure it doesn't happen again. Sometimes if it keeps happening, then that's when you do a surgical resection where you remove the cyst wall, the entire cyst. You drain it and remove the covering of the cyst. Okay. It can be done laparoscopically or open. Usually, nowadays you do it laparoscopically through small incisions. Okay? So that's benign cyst. Okay, or a simple cyst, I mean. The next one is also a cyst, but it's more complicated or more complex. So we have the biliary cystadenoma. So it's also cystic. A cyst, when you say cystic or a cyst, it's a tumor or a mass that has fluid inside. Okay? So this is also it's kind of like the previous one, but it's complex in that it has internal septations like this. Like if you look at the previous one, it's just one round lesion right here. Okay? But if you look at this, you can see that it has separate walls. So those are the septations. And it's also thicker than that of a simple cyst. So this one can also become malignant. When you say malignant, it becomes cancerous. And these kind of cysts, you gotta resect, you gotta take them out. Surgically remove this, including the walls. Okay, because it can turn into cancer. Alright? So all these CT scans, I got this from Google. Thank you, Google. Thank you, Google, for your service. Alright? Alright, next one is a hemangioma. A hemangioma is it's a vascular tumor. When I say vascular, it's made out of blood vessels. So it is the most common benign liver tumor. Alright? It is congenital, meaning you are born with it. It's a congenital malformation. So when you say hemangioma, it's from heme or hema, it means blood. Okay? So it's a malformation of the blood vessels inside the liver. A hemangioma can form in any part. It can also form in the skin, actually, and even the brain. But this is called a hepatic hemangioma. Hepatic meaning liver. So it's a malformation made out of blood vessels in the liver. It's usually slow growing, or it doesn't grow at all. Like, you would be bored with it, and then it just stays there. It doesn't grow, it just stays there. So if you have it and nothing happens, like it's just there existing but not really doing anything, you don't really touch it. Okay? But if it gets larger, let's say it got bigger, it becomes like more than 5 centimeters, then they follow it up. We observe it if it grows even larger, because if it grows even larger, it has a tendency to bleed. So we need to have that removed, because you could bleed to death. Okay. So next, here's a CT scan. Alright, this is a CT scan for a hemangioma. So this just has different views. So if you look at this is the tumor over here. So it's kind of lighting up, unlike the other images, because of the blood vessels. So that's a hemangioma. Alright, this is just this one is a CT scan without the contrast. This one has, so you can see that it has some vascular markings. Okay, those are vascular. I'm no pro at reading CT scans, by the way, because I'm not a radiologist. So I can only, usually when I look at CT scans, I would be like, oh, there's an abnormal structure right here. But sometimes I won't know what it is. I just know if there's something weird going on in the CT scan. So yeah, but this is how a liver looks like. This is the liver, and seeing something like this, it's abnormal. But this is an example of a hemangioma. Okay. Next is an adenoma, a hepatic adenoma. So this is a solid tumor, unlike the previous ones. It has a high risk for malignancy, or it's risk, or more like it has a tendency to become malignant. or cancerous. So it's usually seen in those people with fatty liver disease, or those who have estrogen exposure, like taking oral contraceptives, some steroids, or if they have glycogen storage diseases. If it's tiny, they don't touch it, but if it's big enough, or if it grows, then that's when you need to have it removed. Okay? Sometimes if it is caused by contraceptives, then what they do is they have the person stop taking the contraceptives for like a few months, and then they repeat the CT scan and see if the tumor gets smaller. But if it doesn't get any smaller, if it still grows or nothing happens, then they remove it. Okay. And then lastly, we have the focal nodular hyperplasia, which is the second most common benign liver tumor. It is also solid, and the difference between this and the adenoma here is that it has a central scar on the scan. So look at this. It looks like an adenoma like this, but the difference is it has a little scar right here in the middle. This is the central scar. And when you have a tumor like this, you just you have to do a surgical resection, a hepatectomy, or you resect it. You take it out. Right? Next. Alright, malignant tumors. So these are the bad boys. Cancer. Okay? So we have the most common primary cancer of the liver, which is hepatocellular carcinoma. Sometimes we abbreviate this to HCC. Look at how ugly it is. This image right next to my head. That is an ugly ass looking tumor. Anyway, risk factors for this: cirrhosis, okay, chronic liver disease, alcoholic liver disease, hepatitis B and C especially. Okay. So on CT scan, if you have this one, is a CT scan of a big ass tumor right here. Look at this. This one right here, this is the liver. And right over here is a huge tumor. Most likely hepatocellular carcinoma. Okay, look how big this is. This is pretty much covering the entire right lobe of the liver. Okay? And here we go. Look at this. This is just a picture I got off Google for the stages of liver damage. A healthy liver is like a color of a healthy liver, or how a healthy liver looks like. It's supposed to be smooth and like reddish brown. It's smooth, reddish brown. That would be a healthy one, and it's you know, the edges of the liver is sharp. They're sharp. It's not blunted. So that's a healthy liver. If you have a fatty liver, the liver is like slightly orange, or yellow. Here it's yellow, but if you look at it in like in real life, it would be like reddish to like orange. Okay, that would be a fatty liver. And then if you have a fibrotic liver, it's going to be grayish in color, slightly gray. When you enter cirrhosis, the liver looks pretty nasty. It's rough. It's not as smooth. Here you can see how smooth it is. If it's a cirrhotic liver, it's rough, and actually it's nasty looking. It actually looks nasty. And even more so if you have cancer. Cancer is like the ugliest. It looks like a freaking alien. That's what it is. That's what it is. Okay? It looks like you have an alien growing out of your liver. Is that arranged according to severity? Pretty much. It's like stages of liver damage. So, take care of your liver, guys. If you have fatty liver, then that's, you gotta watch your diet. Okay? It means your, liver is, on the way, it's damaged. It's on the way to cirrhosis. So take care of your livers. Okay? You don't want to have liver cirrhosis, by the way. It really looks nasty. I can show you photos on Google. It doesn't look good. I can show you how a normal liver looks like, and a normal liver looks nice. It's like a reddish brown and shiny. And then you go to liver cirrhosis and it looks disgusting. And it feels disgusting too. Okay. Alright, let's see. Next. The next one is metastatic liver tumors. This one is the most common type of malignant liver tumor. When you say metastatic, it means it came from another type of cancer from another area of the body. So, usually these metastatic liver tumors, they're usually multiple. Unlike in HCC or hepatocellular carcinoma, they're just one lesion that can be small or one big-ass lesion in the liver. But if you have metastatic, they usually come in multiples, like this. Okay? And these are more common than the primary liver cancers. So if you have a metastatic liver tumor, if it's metastatic, that means your primary cancer is from somewhere else. And one of the most common one is the colorectal cancer, or cancer in the colon or the rectum. They like if you have cancer there, they like to scatter into the liver. There's also ovarian cancer if you're a female, if you're a woman. It can also spread to your liver, or it can go to your lungs. If you have breast cancer, it can go to your liver as well, or to your bone, to your lungs, or even to your brain. Okay? Pancreatic cancer, of course, goes to the liver as well, and it can also go to the lungs. And if you have lung cancer, it can spread to your adrenal glands. It can spread to the bone. Rarely it goes to the liver, if you notice. See, it rarely goes to the liver. But everything else, mostly, it just goes to the liver. Okay? So, and when they scatter to the liver, it's usually multiple. And these kind of things, you can't really... If you have multiple tumors like this, you can't resect them because there's way too many. Remember, you have only one liver, and if you take out the liver, or if your liver is diseased, you won't be able to live without it. Okay? So, treatment options. Oh. Do I not have... Okay. I don't have image. I was supposed to put an image here. I didn't put the image. I didn't put image! Okay, surgical options, okay? For, treatment options for malignant tumors, okay? One of them is surgical resection. If it's surgical resection, you usually remove a part of, we usually, resect a part of the liver, and it's called a hepatectomy. So, this is a major surgery. A hepatectomy is a major surgery. And the patient must be fit for it. And when you resect a tumor, a malignant tumor from the liver, you have to make sure you get everything. That's why they say negative margins. It means there should be, when you send the tumor or the specimen to the histopath, you gotta make sure you got everything. There's also ablation therapy, which is like you burn the tumor in a way. This is for people who are not fit for surgery because they're not cleared. They have other illnesses that can, increase their they make them higher risk. And it's also for smaller tumors that are 2 to 3 centimeters. Okay. So, ablation, we don't really handle this. This one is handled by this is not handled by a surgeon. This is handled by someone else. So, we surgeons just, cut and remove. Okay? Another one is intraarterial embolization. Okay, so, this is for people who are not candidates for surgery or for ablation, okay? But it can be used as a bridge to transplantation or for ablation of larger tumors, like 3 to 5. So this helps make the tumor smaller, in a way. But this is also not done by us surgeons. So, actually, I have not really seen this one done. Okay. Lastly, we have liver transplant. So, liver transplant is very complex. And as far as I know, liver transplant is not yet as big here in the country, in the Philippines. I think it's like, liver transplant is probably more common in, like Japan or Korea, or Taiwan, in other countries. Which is why, as far as I know, Japan, Korea, they are more advanced when it comes to liver surgeries. So I think also in the US also, and Europe, they have liver transplant. We have liver transplant here in the Philippines, but in like only in specialized centers. So as far as I know, NKTI is one. In case you need a liver transplant, go to NKTI. I have no idea how many transplants they have, liver transplants they have on a monthly basis. But I do know they get a lot of kidney transplants. So liver transplant is a different story because this is I don't think it's that common here, because liver transplant is pretty expensive. Okay, so the patient has to meet a certain criteria, like the liver, the mass has to be 5 centimeters or less, or you can only have up to 3 of the nodules measuring like 3 centimeters or more. You know, so there's like a criteria for that. And this again is for specialized surgeons. I am not specialized. I have not seen a liver transplant yet. Okay, so I can't really expound on this one. Okay, I have not seen a liver transplant, but it would be really cool to see one. Okay. Alright, so next is the patient. Okay, we're gonna talk about the patient. Oh, but before we do that, guys, you guys have any questions? You guys have any questions before we go to the patient's case? I drink my water. We'll look at the chat. Hi, Doc. My liver hurts when I drink a lot of water. A few months ago, I drank water every 1 or 2 hours after I pee or do number 2. What's the problem? Liver? How do you know what's your liver hurting? When you drink water, it's not your liver that's hurting. What? Liver symptoms don't usually show up until it's too late. Yeah, pretty much. Pretty much, that's true. That's true. The liver is it is a silent organ. You have only one liver. And liver problems start showing up when you're older. Okay, so take care of your liver, guys. You have only one liver. And if you do need a resection or a hepatectomy, they can only remove, or only a portion of your liver can be removed. They can't remove your entire liver. And when they do have to remove a large chunk of your liver, like 20% of your liver has to remain in your body. Okay? Or else you can't live without your liver. Okay, no one has questions? Okay. So, again, back to the case. This patient needs help. So this is the reason why I'm holding this medical education stream. It's for her, just so you guys are aware. And I want to help her out because she needs surgery for her liver. So the patient is at the girl for her confidentiality. Okay. Si ate girl. I didn't put the age. Call her ate girl. She's a female living in the Philippines. Okay. Alright. History of her illness. Her chief complaint is abdominal pain. Alright. So she has a 3-month history of abdominal pain on the epigastric area. Well, epigastric area means on the upper middle of the abdomen. Okay. She didn't have any other symptoms, like no nausea, no vomiting, no changes in her bowel movement. She didn't even have jaundice. And there was no weight loss. She would just have abdominal pain. That's it. That's her presentation. Abdominal pain that didn't go away. Okay, like on and off. So she had a checkup done, you know, the doctors were thinking, oh, it's probably gallstones. So they did an ultrasound. But when they did an ultrasound, they saw a mass in her liver. They saw a tumor. Okay? And because they saw a mass in her liver, they ordered for a CT scan. Triphasic. And that's when they saw the CT scan, there was a hepatic adenoma. The CT scan read it as to consider a hepatic adenoma. Now, because of this, they after further questioning the patient. So, a review of systems are unremarkable. Her past medical history, she has no known illnesses. So, no hypertension, no known diabetes, no known surgeries, nothing. Even in her family, there's nothing, there's no other illnesses. Okay? But, in her personal social history, she is an oral contraceptive user. She uses oral contraceptives for several years. I know the exact number of years, but I decided not to put it here for patient confidentiality, so I'll just say several years. So she's been in OCPs for quite a while. And because of this, her physical exam, okay. Her abdomen, I just focused on the pertinent. So she does not have jaundice, her vital signs are stable. Her abdomen, because she complained of abdominal pain, I decided to focus this there. Her abdomen is soft, it's flat, there's normal active bowel sounds, it's non-tender, there are no palpable masses. There's nothing. She basically looks normal. She basically looks normal. Okay. So the primary impression we have is hepatic adenoma. Now, when they found out she was taking oral contraceptives. Yes, oral contraceptives, because if you look back on our slide... Okay, wait. If we look back at, where is it? Where's the... Ito. If you look back here, guys. Adenoma. Usually seen in those with fatty liver, those with estrogen exposure, especially contraceptives. Okay? She fits the picture. She fits the picture. So, the first thing we did, was tell her to stop taking her contraceptives. Okay? Stop taking your contraceptives and we're gonna observe this tumor. So she stopped. Unfortunately, though, after we told her to stop, we did a repeat CT scan a few months later, and we looked at the tumor, and there was no change. It was still big. Okay, the tumor was actually quite large. It was like 4 centimeters. When she stopped taking it, the tumor was still about the same size. So it's usually if you stop the contraceptives, it should get smaller, but nope, it didn't happen. It was still the same size. So that is why the plan is to do a surgery. Okay? Even though the usual is that it's at 5 cm, that's when you do surgery. For her, it didn't improve at all. So we might as well have it removed. Because, again, a hepatic adenoma has a tendency to become malignant or to become cancer. So we want to avoid that. We want to avoid that, her tumor to evolving into cancer. So we might as well take it out. Alright? So the plan is a hepatectomy of that portion, or not. We're gonna do a segmentectomy, okay? We're not gonna remove entirety of her liver. If I remember correctly, the what do you call this? The tumor. Let's go back to the anatomy, okay? Here we go. This is why we say this is important. Her tumor is somewhere around here, if I remember correctly. So, we don't need to remove the entirety of this lobe. We just need to remove a portion of this. It's segment 7. Okay? Yeah, cutting her liver. And this is a major surgery. It's not as easy as like removing the gallbladder or removing the appendix. It's as major as doing a colorectal surgery or cancer surgery. It's also very bloody because like I said, if you looked at the if you remember the anatomy of the liver, look at how it's a very highly vascular organ. So any injury to the liver, any cut you do, it bleeds. It bleeds a lot. It really bleeds. So it's not exactly an easy or a simple surgery. We actually have a hepatobiliary surgeon on board this one. Okay. So, yeah. Now, the thing with this surgery is that the liver surgeries need specialized equipment. So, this patient needs help with that. Some items that is needed for her surgery are not available in the hospital, so she has to get them outside. And that's where the expenses come in. And that's why I want to help her, because we gotta take that tumor out. If we want her to live longer, we gotta take that tumor out before it turns into cancer. Because when it turns into cancer, it's gonna be even worse. Okay? So, actually, that's my last slide. I think this is my last slide. Yeah, it's my last slide. I forgot to put an end. I forgot to put an ending slide. But anyway, yeah, that is the last slide. Do you guys have any questions? I forgot to put like an end slide. I usually put like another slide at the end that says end, but I forgot. More examples. You want to see some examples? Okay, hold on. Okay. You guys want to see videos of like liver? Okay, I'm gonna show you. I am going to show you guys. Oh my god, what happened to my chat? You guys disappeared. Oh no! What happened to you? May quiz po ba? Aba, may nagre-remind ng quiz. Alright, I'm going to show you some examples of liver. Hold on. Normal liver. Ooh, this one. Anyway, we're on YouTube, so I can show you all the gross pictures. Hey, look at this. Let's see. Ooh, what is this? Hold on. I am looking at a liver, but I don't know what creature this is. Is this a human liver? What creature? Oh, here we go. This one is good. Ha! This one. Okay, open image in new tab. There we go. Alright, guys. I'm gonna flash you guys. I am going to flash you guys some nasty photos. Okay. This is an example of The one on top is a normal, healthy liver, okay? Like I said, it's like reddish brown. And below that is a cirrhotic liver. Look how disgusting it looks, okay? This is how nasty a cirrhotic liver looks, okay? Kumakain ng sisig. Sisig! Adobo! Bruh! Okay, this is disgusting, okay? Look how nasty a freaking cirrhotic liver is, okay? You don't want your liver to look like this. This is disgusting, okay? Imagine you want the liver to look... You want your liver to look like the one on top, okay? This one. You want it to look like this. You do not want it to look like this. This is disgusting, okay? Ew. Ew. Look at this. We got some liver examples here. Liver scarring. Look at that. That is disgusting. Ew. 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 Who baked the liver? Alright? Take care of your liver, guys. Take good care of your liver. Because you only have one of those. And you don't want it to look like this monstrosity here. Okay. Let's see. Is there more? Look at this. Oh, look at this. This one looks like a normal looking liver. Like the underside of the liver, though. What is this? Oh, here. This is another picture of the liver, but they like chopped it up. I don't know why it was chopped up on this. So yeah, your liver is supposed to be like reddish brown. That is the normal liver. And it's supposed to be shiny and clean looking, but not look like aliens planted eggs on them. Okay, and then hold on. I am going to... Let's see if there's a hepatectomy. A5 Wagyu liver, what? Okay, there's gotta be like a quick, standard right hepatectomy, it seems. Is there like a... Oh no, this one's boring, you know. I'm looking for like a short... Ooh. Hold on. Extended left hepatectomy, right hepatectomy. Ooh. Oh, yo. Okay, guys, wanna see some surgery? Hold on. How do I, Here we go. I don't know if you can see this. Look at this. They are... I don't know what they're doing. Surgery! Chopped cassette. Wait, is this... This is like liver surgery right here. Is it safe for YouTube? Yeah, this is on YouTube, so it is safe for YouTube. This video is on YouTube, so it should be safe. You know, YouTube is actually safer for me to do medical education streams rather than Twitch, which is why I'm here. Which is why I decided to do this here on YouTube, because it's safer and the VODs can just be, you know, VODs are here. Look at that! Look at this liver! Oh look, they took out a chunk of liver over here! Look at this! I paused it. Look at this! They took out a little chunk of the liver over here. I don't know why though. Oh, it's probably a tumor. It says here metastatic rectal cancer, so there's probably like a tiny little tumor here that they removed. That's why there's a little sugat na siya. Okay. Look at this. They're gonna ligate the right hepatic artery. And so basically what you see here is almost the same as what we're gonna do. Kinda. This is an extensive hepatectomy, what we're gonna do, what the patient I have is gonna be have is just like only a segment of the liver is gonna be removed, not like an entire lobe of the liver. So this is cool stuff. Look at this! Look at that liver! Look how shiny it is. And you can see like little holes here, so they started removing some of the tumors. This thing over here, this white thing, is an ultrasound, so they're also searching for other tumors that can't be seen. Like with the naked eye, they have to put an ultrasound. So every time there is a liver resection or a hepatectomy, they have to have an ultrasound so that they can scan the liver real time. Because if you look at the liver, sometimes you don't see the tumor. The tumor is deep within the tissue of the parenchyma of the liver, and you need an ultrasound. Okay, look at that. You get chunks of the liver removed. Oh my God, they're marking the liver now. This is them marking the liver and how much they're gonna take off. Ooh, staplers. Doc, what's the size difference between an alcoholic's liver? Oh, it can get really big. It can get really big. So, yeah, here we go. Oh, there, look, they're gonna start cutting up the liver now. And this is how the liver looks like when you're cutting it. It looks just like what you eat in, what do you call that? You know, those, innards that you eat. Parang ganun din. Looks just like that. But, see, when you do a liver resection, okay, I'm gonna pause it. When they do a liver resection or a hepatectomy, you can't just like cut through the liver haphazardly. You have to be careful because remember the photo I showed you a while ago? It is a very vascular, it is a very complex system inside the liver. You have to make sure that you catch those vessels and then you have to tie them or ligate them so that they don't bleed. Okay? So look at this one. They're getting all the they're separating the vessels and the ducts, and I think this is more of a vessel. I think this is a vessel, yeah. They're carefully separating it, and then they're going to tie it or ligate it. So there we go. This is ligating. He's tying it. What the hell is a G8 door? What? I don't know what this stands for. What's a G8 door? I don't know what that stands for. That's advanced. Okay, that one is advanced stuff that I don't know. That came out of nowhere. That one I don't know. Like I said, liver or hepatobiliary is next level stuff, so I can only teach like the general overview. Anything more than that is really, it's specialized. Just like how specialized thoracic surgery is, or neurosurgery, it's really, it's specialized. Okay? It's specialized. I don't know what that is. G8 vent. I should probably look this up. You know what? I'm gonna look it up right now. Wait, hold on. What is that? G8 door, G8 vent? Oh. Oh, okay. It's just a short. Oh, okay. Like dorsal branch. Oh, okay. This is some next level surgeon lingo. Yeah, okay. This is next level surgeon. This is next level lingo. Okay, that's a hepatobiliary thing. This is something we don't really, as a general surgeon, we don't really use these. Okay, this is why the patient is referred to a hepatobiliary surgeon. Yeah. The review needed. Yeah, this is those kind of things aren't something you learn in med school. Okay, You learn only the general overview of this, and that's what I know. As a general surgeon, I'm not exactly I'm not a hepatobiliary surgeon. This patient was referred to a hepatobiliary surgeon, so we're gonna co-manage this. And yeah, they don't know I'm a VTuber. Yo. There we go. Okay? So I think let's see. They also don't know your title. Yeah. I think, but that's all. Let's see. It's 10. There we go. There we go, they're removing it. Oh, I think they removed the other... I need to go to the part where they... Oh, here, this one. This is it. When they actually... Look, this is when they take out that portion of the liver. So gory, yeah, it is. Alright, so that's all. Hold on. Okay, this is surgery residency level. Yo, they didn't teach that. They didn't teach us that in surgery residency. Not that level though. But that's probably because we don't really have many liver resections, to be honest. It really goes to the specialized ones. It's probably like in other countries or in hospitals that actually have liver sections more commonly, they probably teach that. But not for us. What's this? Is the tumor hard or soft? It's like spongy. Hard. If it's cancer, that one's hard. Cancer is usually really hard. Firm. Dr. Shiori, when the patient asks for anesthesia. Where does the suck blood go? Oh, there's a suction machine. There's a canister for it. So, with a measuring, there's a canister for it with measurement, so we know how much blood loss there was at the end of the surgery. Hello, Dianjo. Hello. So anyway, you guys have any other questions? Is it thrown away? Yeah, it is. It is. We don't keep that. We don't keep that. It is thrown away. Okay. Not a surgeon, but I was mildly astonished when I found out about the concept of surgical subspecialties. Yeah, you know, medicine started off as like simple, and then you have different specialties, like different kinds of doctors. You have like internal medicine, a surgeon, a pediatrician, and then each of those have subspecialties, because that's where it's headed. That's the future. For like medicine, internal medicine, you have like nephrologist, gastroenterologist, endocrinologists and all that, pulmonologists, yada yada. And then surgeons also have the same. There's breast surgeons now. There is colorectal, hepatobiliary. There's also TCVS, or the surgeons for the heart and lungs, the thoracic surgeons. There's also peripheral vascular surgery, or vascular surgeons. There's neurosurgeons. There's urologists, etc., etc. There's a lot of subspecialties. Even minimally invasive surgery. Those are the ones that like to do laparoscopic. There's also and a new one is robotic surgery. That one is kinda new in this country. I think they started introducing it in I think robotic surgery is already in like St. Luke's or something. And in those tertiary hospitals. But those are really, really expensive. Robotic surgery is actually interesting to me. I actually wanna train in that. What do you do with the removed parts? We send them for histopathology or biopsy. Okay. Usually, what's the recovery period for these kinds of surgery? Huh. It takes a while, but like, if they recover quickly, like a few days after the surgery, we send them home, and then they can just rest at home, and then we do a close follow-up. But we're gonna do this open, so not laparoscopic, so she's gonna take a while because that's a very big incision. If I remember correctly, the training for non-invasive is like video games. Well, it's more kinda like that, yeah. You know, there are laparoscopic trainers that they train residents now. There are virtual ones. There are virtual trainers now. And it's actually pretty cool. Yeah, the simulators. But yeah, next topic talk for next month's robotic surgery. It would be cool, but unfortunately, robotic surgery is something new, and I have not tried it. Maybe if I've tried it already, I gotta train on that. I have to have training on robotic surgery. I don't have training for robotic surgery. I think I remember the hospital I work in doing a press release for robotic surgery a while back. Oh, really? Okay. So anyway, do you guys have any other questions? I think it is 10. I usually do my medical education streams about an hour and a half, so we are actually good. We're good now. Unless you guys have more questions. So, if none, then we done. Yeah. So, yeah, if you guys wanna, you guys don't have to donate. It's just, if you wanna help, you can help. This is 100% of, donations will go to the patient. Okay? So the goal is $500. This is just to help her out, with the materials, she needs for her surgery. So yeah, I can't again I can't hold a donathon for this because I don't have this time I don't have the time to hold a donathon. And even if I did, like, the only time I would have the Donathon would be like, the only time available, supposedly would be this Friday, because Friday's a holiday. But I have some obligations, so I really can't. That's the reason why. Unfortunately. This August is actually pretty busy for me. And I'm hoping that starting next month, it'll be less busy. I really want to stream more frequently than I do now. I used to stream like, 3 to 4 times a week? But now I only do 2 to 3 times a week. Quiz! You guys want a quiz? Okay. Wait, I don't have my... You guys want a quiz? I don't have my tablet prepared. Friday's a holiday? Yeah, Friday's a holiday. It was supposed to be today, but they moved, the president moved it to Friday. Long weekend for nas normies. Sana all may long weekend. Anyway, yeah, okay, you want quiz? Quiz? Okay, guys, prepare 1/4 sheet of paper. I can't write the question, so you're gonna have to just listen in. You're gonna have to listen in. Because I forgot to put an ending slide on my on my PowerPoint. I forgot to put an end slide. So I don't have space there. Meron dyan, mahilig mag-ano ng quiz. Okay, number 1. Okay, guys, number 1. Number 1, what is... Give me one function of the liver. Pahiram pilot ballpen. Kailangan pa talaga pilot ballpen na black. Specific ballpen requirements. Detox blood cleansing. That sounds so... Blood cleansing. That sounds so... Takes up space filtering blood. Need... Ano? Paulit pa, mami. Anong paulit? Hindi ka nakikinig. Okay, let's see. Blood. Okay, detox, yes. Blood detox? No! That's a kidney's job. The detox is like detox from it's drug detoxification, yo. You guys are giving like kidney functions. Letter A. Alright, next question. Metabolism, yes, metabolism. Alright, next question. What do you call the symptom wherein your skin turns yellow because of a liver disease? What do you call it when your skin turns yellow because of a biliary disease or a liver disease? Hepatitis. Simpsons effect. Kita ko na yung mga bumabagsak. Ihi de la skin. Simpsonitis. Okay, the answer's jaundice, you guys. Jaundice. Right. Ano na? Next question. Ano ba tayo? Number 3? Number 3! What is the most common benign liver tumor? Most common benign liver tumor. Yeah. Hi, ma'am. Sorry, late my quiz agad. Oh, quiz. Yung mga late minus 100. Cirrhosis. Hemangioma. Ang mga late minus 100. Holy! Most common benign liver tumor. Benign. Okay, benign. Wala na. Maraming bagsak. Maraming bagsak! Prim got it right. It's hemangioma. Hemangioma. Okay. Ang daming bumagsak. Alright, next question. Next question. Most common primary malignant tumor. Most common primary malignant tumor. Okay lang kung mag-repeat lang sa class nito. Si Hemangioma. Hemangioma, cirrhosis. Wala walang tumatama. No one's getting it right. No, the other question was most common benign liver tumor. This is what I'm talking about. Most common primary malignant liver tumor. No one's getting it. Walang may alam. Hemangioma, no. Prim has it like half right. Kinain ko ng aso ko yung atay ko. No. Okay, you guys. Wala! You all failed. All of you failed. Minus 50 points. Hindsight, what does HCC mean? You gotta spell that out. What is HCC? What is HCC? Hindsight has it. Headcanon community. Hotdog, chicken, chicharon. Ano? There you go. Hindsight got it. Ayan, si Hindsight got it correct, so he gets plus 50 points. Everyone else gets minus 50. So that means everyone else failed. Alright. Okay. Pass your papers. Pero, wala. Yung mga bumagsak, itapon nyo lang yung papel nyo. Those who failed, just throw your paper in the trash. Mga basura. Okay. But yeah. Otsupon, guys. Thank you for coming to my stream. Thank you. And I hope you guys continue to support me. Like, your support is always appreciated. You guys have, you guys have helped a lot of my patients, by the way, by just supporting. Okay? Actually, just watching my streams is good enough for me. Otsuduck learn more this time. Yeah, I hope you guys learned a lot here. This one was a little hard for me to teach because, it's not easy. Liver is a very complex organ. It's not my thing. Anyway, my next stream will be on, when is my next stream? My next stream will be on Twitch, and, it will be on... on Friday. Friday, yeah. Friday, I'll be playing Tekken 8. Okay, I'll be playing Tekken 8. I'll be playing Quick Plays and Ranked as Mighty Ruler. I am now Mighty Ruler on Tekken 8. So yeah, I'll be playing on Twitch. So for those who are new here, I think I think one person subscribed while I was streaming. For those who are new here and discovered me through this stream, I stream more frequently on Twitch. I play video games, variety of games. Recently, when Tekken 8 came out, I play a lot of Tekken 8. At least I stream that at least once a week now on Twitch. So yeah, my medical education streams are usually once a month, also on YouTube. So that's it. Okay. Take care, doc. Thank you for doing these. I hope you're doing well. You're welcome, and I hope you guys learned a lot. Okay. Thank you, guys. Otsupon. I'll see you guys on Friday on Twitch. Thank you so much. Bye bye, Otsu.